I already forgot what it stands for. Oh, whoops. Let's Google it. Hey everyone, on this episode of Coding with Kate, we are going to be talking about the AAPC versus AHIMA. I got a question about what are the differences between the two, which one should I go for certification-wise, what are their courses like, etc. So today we're going to work through them, and I'm trying something a bit different where you can see my screen and I'll have it somewhere in the video. Hopefully this works. I hope. So AHIMA, American Health Information Management Association, and the AAPC stands for American Academy of Professional Coders. So let's start out with AHIMA. So on their main web page, you can see on the tabs up here, you can look at certifications, their education, all that good stuff. Let's talk about certifications. So as you can see here, they have the RHIA, RHIT, CCA, CCS, and CCSP. The RHIA and RHIT are more for the medical records department or managerial leadership positions, and medical records or coding department, we're not going to talk about that. The CCA, Certified Coding Associate, and CCS, Certified Coding Specialist, and CCSP, Certified Coding Specialist Physician. The CCA is your entry-level basic certification. That's what you want to start off with. The CCS is much more complicated and you need a little bit more expertise or experience on the job for those. So I suggest CCA. And you can click on them where you can get an overview, how to apply for the exam, and exam prep, etc. So it gives you a nice explanation of what the CCA is and what requirements you need to obtain that certification. But let's go to exam prep. So this gives you all resources, but specifically, let's go down to the Cca Exam Content online, because this will tell you what's all in the exam, because that will also help you decide what you want to go for. So the CCA, 100 multiple choice questions, and it takes about 2 hours. It covers things like different code assignments, how to apply codes, how to navigate the book, how to apply guidelines when you are applying codes. It covers reimbursement, so more of how to sequence the codes for optimum reimbursement and all of the different reimbursement abbreviations like a DRG and APC and NCCI and all that stuff. I haven't gotten to the reimbursement course, so I don't know about any of that. And then it covers health record and data content, so knowing what the medical records look like, what pertinent information is in there and where to find it. We have compliance and being able to find any issues with coding assignment, how to fix it, or what documentation is needed to support the code assignment that you are applying, all that good stuff. Information technology, so knowing all about the EHR, electronic health record, and the programs used. From what I can tell, Epic is a very big one. That is a big program that has all of the medical records and patient information, all that on the program, so it's all electronic. There aren't any paper records that are filed away to be brought out. Everything is put onto Epic, the EHR, or entered directly into it. So knowing all of that sort of thing and how to find that information and the records needed. And then confidentiality and privacy, so everything with HIPAA, all that good stuff. So that essentially is what the CCA covers. So it does cover more of what you'd call theory for coding, and it does have a pretty good chunk on actual coding. All right, let's go over to education. go to courses so we can see what type of online education AHIMA offers. So they have different programs, but we are specifically going to be looking at Coding Basics program. And it covers ICD-10-CM, the Diagnosis Codebook, ICD-10 PCS, Procedural Coding System, CPT and HCPCS, and then a whole plethora of other topics. So it is a very well-rounded course, as well as the certification is very well-rounded. Let's look price-wise. Okay, so you can go onto their store where you can get books and all of that stuff that are published by AHIMA, code books, all that good stuff, or you can go and look at the courses for the bundle. You can get each course individually if you would like, but you can also get it as a bundle. Coding Basics program. Yes, please. So the Coding Basics program gives you biomedical, so A&P, med terms, path and pharm. For your HIM industry, healthcare delivery systems, healthcare data content and structure, computer basics and healthcare, medical law and ethics, reimbursement methodology, and then ICD-10-CM, ICD-10 PCS, CPT, and professional coding practice for a wonderful price of $2,340, which is so much better than in a brick and mortar university. So that is about what you're going to pay for the online courses if you get the bundle through AHIMA. All right, now let's jump over to AAPC. So the AAPC has quite a few different categories of certifications. Let's go to that. So they have coding, billing, auditing, compliance, practice manager, and instructor. So this has a lot more outside of coding and billing. But let's go to coding. So as far as their coding certifications, they have the CPC, Certified Professional Coder. That's your base or entry level certification. COC, Certified Outpatient Coding. CIC, Certified Inpatient Coder. CRC, Certified Risk Adjustment Coder. And Specialty Coding Certification, which is all of these. All sorts of different specialties that we're not even going to go into. So let's just look at CPC. And as you can see here, it says the correct application of CPT, HCPCS Level 2, procedure and supply codes, and ICD-10-CM diagnosis codes. So CPC focuses all on CPT and diagnosis coding. Doesn't even venture into ICD-10 PCS coding, which is interesting. You have to get a completely different certification to do inpatient coding where PCS would be used. Interesting. So about the exam, the CPC exam, there are 150 multiple choice questions, so 50 more than the Cca has through AHIMA. It takes 5 hours and 40 minutes to finish the exam. That's really long. Whereas AHIMA's Cca exam only takes 2 hours, 100 questions. You get one free retake, so that's nice. And it roughly covers the entire CPT code book. The entire thing. Med terms, anatomy, ICD-10-CM, HCPCS Level 2, coding guidance, and compliance and regulatory. So we can click on any of these and we'll get a little bit more in depth on it. So this is what this one is covered. 10 questions there, 10 questions. So it gives you a bit of a breakdown of how many questions for each section of the CPT codebook and the other sections here, and what is definitely covered. Okay, let's go to education. Medical coding. So we want to do CPC training. Let's go to packages and pricing. Okay, so the CPC preparation course So that is your online program. For just the courses, you don't want anything else, you're looking at $1,995. If you want the complete training package, which has the courses, an online practice exam, an exam review, and I guess it actually includes the price to sit for the certification exam, I guess, you're looking at $2,200, or the regular price is $3,400. I'm not sure if there's a sale going on. I don't know. And then they also have one that includes hands-on experience with a practicum, but we're not going to look at that. So it's a bit more expensive than AHIMA if you're looking at for what you're getting out of it. You're just getting ICD-10-CM and CPT. Whereas in AHIMA, you're getting ICD-10-CM, ICD-10-PCS, and CPT, and all the other courses. You're getting a lot more for your money through AHIMA versus the AAPC. Okay, so now, as far as jobs go with the certifications, which one is better as far as what our employer's looking for, they prefer both. From what I've seen, looking at the different job postings in my area, in my state of Wisconsin, they say both. They say CCA or CPC. They say both. They don't have any specific preference. I'm not sure how that is throughout the entire US, but at least in Wisconsin, they don't really care. As long as you have one of the certifications, then you're at least qualified to apply and hopefully get the job. I would suggest looking online at the different job websites, CareerBuilder, Monster.com, any local job websites that you have in your state, your city, and just look at all of the different job openings and what they require as far as what are they looking for certification. See what is asked for in your area and maybe go that route. But if they prefer both, then I would go for looking at pricing or what type of coding you want to do, inpatient or outpatient. Because if you don't want to do anything with inpatient, then go with the AAPC, only because it doesn't even cover PCS coding unless you take courses in it and then get a specific certification added on to your main CPC certification. As far as schooling goes, employers don't really care where you got your education, just as long as you are certified, because you had to have some form of education to get certified, so they know you're going to have a good understanding and basic skill set of coding to be qualified for the job. So they could care less if you went to an actual university or you took the online courses through AHIMA or the AAPC. They don't really care. You just need that certification before they look at your application. But other than that, choose whichever one you like. They're kind of equal as far as pricing wise, very different with what content they have. So it's up to you. I wish that helped, but really look at what environment you want to be working in and then go with what certification offers that. Do that. And that will definitely help you decide as far as what certification you'd like. Other than that, if you have any other questions of stuff that I did not cover or clarifications on anything that I covered, please post them in the comments below. If you have any other questions outside of these organizations, let me know. You can also subscribe to this channel so you can get notifications on all of the videos that I post, so you're always in the know. And like this video if you enjoyed hearing me talk about both of the coding organizations and seeing, hopefully it worked, the websites. like this video, and I will see y'all later. Bye!